Bangladesh has made tremendous achievement in reducing child mortality in the past few decades. But for years together, neonatal mortality remains high. Compared to the national rate, neonatal death in Sylhet is even higher. Main reasons of these deaths are infection, pneumonia, birth asphyxia, and complications of preterm birth and low birth weight. Maternal mortality in Bangladesh is one of the highest in Asia. Over 85% of deliveries still occur at home. The main causes of maternal deaths are hemorrhage, eclampsia, infection, obstructed labor, and the consequences of unsafe abortion. Low utilization of health facilities for maternal, obstetric, and neonatal care services is a critical problem in Bangladesh. Lack of access to essential health information is an important factor for low demand of services. USAID is supporting Access, a safe motherhood and newborn care program in Sylhet district of Bangladesh. The long-term goal of the program is to improve maternal and neonatal outcomes by specifically increasing the practice of healthy maternal and neonatal behaviors both at scale and in a sustainable manner. Access is implemented globally by JPIGO in partnership with Save the Children USA, Constella Futures International, Academy for Educational Development, American College of Nurse Midwives, and Interchurch Medical Assistance. The Access lead partner in Bangladesh is Save the Children, supported by two implementing local partner NGOs, Shimantik and Friends in Village Development Bangladesh and ICDDRB. ICDDRB provides technical support on program design, monitoring, and improvement, and is responsible for the evaluation component. The Access Bangladesh program is modeled on Projonmo 1, a community-based neonatal health program. Access program is developing a more sustainable, scalable model focusing on behavior change and community mobilization. The program started its journey with a program design workshop involving newborn and maternal health experts from home and abroad. Field implementation in Sylhet is fully underway. The program impact area reaches a population of 1.5 million. To date, 286 access counselors who are young female recruited from their own working area, trained, and have begun making home visits. In addition, 110 community mobilizers, both male and female, have been recruited, trained, and have started work. An access counselor, the key behavior change agent, is responsible for a population of approximately 5,000. The program started rolling out with mapping the villages, demarcating individual households in order to separate cluster and blocks.
আমরা খাস হইল কি গর্ভবতী মা ও নবজাতক শিশু লইয়া তো আমরা কি একটা বাড়ি 3 মাস পর পর আইয়া দেখি গর্ভবতী মা আসেনি আর আমরা খাস হইল কি মা ও শিশুর স্বাস্থ্যর মান উন্নয়ন দেখা গেছে
ACES registers all married women of reproductive age in her area and conducts a house-to-house surveillance for pregnancy on a quarterly basis. During pregnancy surveillance, she lets the newly identified pregnant women know her expected date of delivery and the dates of antenatal visits she will pay to her. Access counselors visit each pregnant woman in the program area 4 times, twice during pregnancy, once within 24 hours after childbirth, and once 5 to 7 days after delivery. During the first 2 visits, the counselor provides critical information to ensure a safe delivery and a healthy outcome for mother and baby. She educates the mother-to-be newborn care person, traditional birth attendant, and other family member with pictorial flip chart.
দেখা যাচ্ছে যে আশ্বিন মাসের 29 তারিখ একটা ডেলিভারির সম্ভাব্য তারিখ আছে বাংলা হিসাবে, আর যদি আপনি কোন ইংরেজি হিসাব দিতাম আমি তাইলে আপনার ইংরেজি হিসাব আমি দিয়ে দিতাম পারতাম। ইংরেজি তো বেশি আমরা বুঝি না, খালি মূর্খ মানুষ, বাংলাও বুঝি, বাংলা বুঝে যাচ্ছে।
The counselors, with the help of specially made stuffed dolls, demonstrate how to dry and wrap the newborn, how to tie and cut the cord, and how to put the baby in a skin-to-skin position. She also demonstrates how to use a clean delivery kit. They explain the need for regular antenatal checkups, adequate food intake, and tetanus vaccinations from government or NGO facilities. The counselors advise families to make arrangements for transport and other costs in case there is an emergency.
পদাপদ আল্লাহ না করুক, আমরা অনেক সময় অনেক বিপদ আপদ একবারে লাগে, আমরা কি তা করা লাগবে, টাকা পয়সা এগুলো আছে রাখছেন নিভাবে। আচ্ছা, আর একটা গাড়ি বা যানবাহন কইয়া রাখা বাইরে কইছেন তো, বাইরে রাখছেন নি হইলো। আচ্ছা।
At the end of the second visit, pregnant women are supplied with clean delivery kits, pictures to help them remember counselors' advice, and referral slips to obtain routine antenatal checkups and TT injections. She also leaves a self-addressed delivery notification card requesting family members to inform her as soon as the delivery takes place.
হ্যালো, আসসালামু আলাইকুম। জি আপা, কোন জায়গায়, কোন গ্রামে? বাচ্চা কোন সময় হয়েছে? ও আচ্ছা আচ্ছা, ঠিক চিনছি আপা, চিনছি। হ্যাঁ।
The last two visits after birth provide information and support to ensure both mother and baby get the necessary preventive and curative care. She provides information about benefits of exclusive breastfeeding, clean cord care, delayed bathing, looks for danger signs in mother and newborn. A physical examination of the newborn is conducted in these visits.
বাচ্চারে বুকের দুধটা খাওয়াইবা, ওখানে খাওয়ানোর সময় তুমি বাচ্চার মাথাটা সুন্দরভাবে আতাল দেয়, আদর করবা বাচ্চারে। এইভাবে আপনি 6 মাস পর্যন্ত শুধুমাত্র নিজের বুকের দুধ খাওয়াবে, ফোঁটা সাদা পানিও খাওয়াইবা না। এরপরে বাচ্চার নাভিক তো কিচ্ছু লাগাইছেন না, আর কোনো কিছুও লাগাইবেন না।
There has been evidence of home practice improvements, uptake of many desired home-based essential newborn care practices like birth planning, delayed bathing, drying and wrapping, cord care. Immediate breastfeeding has been quick and dramatic. Birth notifications were high. Whenever a sickness is found, the counselor refers the newborn and mother to the nearest appropriate health center with a referral slip. Access also includes a community mobilization initiative that works with women's and men's groups to support the counselor's work by encouraging appropriate home care techniques, promoting birth and newborn care planning, assisting the communities to establish emergency transport and financial schemes, and raising awareness about women's rights to adequate health care. Community mobilization has effectively catalyzed the formation of male and female action groups. The project has used the participatory rural appraisal method to develop social mapping in 286 village clusters, identifying all resources in the villages. 458 community action groups have met to prioritize maternal and newborn health problems using body mapping as a tool. These meetings are held in houses, courtyards, marketplaces, even local mosques.
এটা মার কুলে আপনার গর্বে যে সময় আসিল এই সময় আসিল আপনার একটা আপনার এয়ার কন্ডিশনের মধ্যে আর এখন দুনিয়ার মধ্যে আওয়ার পরে এই ঠান্ডা পরিবেশ হয়েছে আবার এক ঠান্ডার উপরে আরো ঠান্ডা তার উপরে বর্তাইয়া গেছে
Pregnant women, newly married couples, traditional birth attendants, mother-in-laws, other women in family, husbands of pregnant women, father-in-laws, heads of families, religious leaders join these meetings. The groups have developed action plans to address problems. These include reopening 3 satellite clinics and 1 EPI center, notifying access counselors of pregnancies and births, influencing religious leaders to include maternal and newborn health messages in their Friday prayers, initiating savings funds, organizing emergency transport for obstetric complications.
আচ্ছা আমরা তো আগর মাথা আছে গাড়ি তখন আমি হ্যাঁ তুমি আধা ঘন্টার ভিতরে যেমনেও আও
To ensure continuity of care and community support, these community action groups select volunteers known as community resource persons. These volunteers follow up the activities need to be undertaken to facilitate care seeking from nearby facilities.
আমাদের এলাকায় সচেতনতা বৃদ্ধি করছে এবং অনেক সিআরপি তৈরি করে যাচ্ছে যারা তারা অ্যাক্সেসের কাউন্সিলররা বা তাদের প্রজেক্ট শেষ হওয়ার পর চলে যাওয়ার পর এই সিআরপিরা কাজ করে যাবে
আমরা নিজের ভাই নিজে দাঁড়াই এখন লাভ হয়েছে আগে আমরা কত বিপদ আপদ আসতো আমরা বাচ্চা কাচ্চা মারা দিত বাচ্চা কাচ্চা নিউমোনিয়া হইতো ঠান্ডা লাগতো
As over 90% deliveries take place at home, Access is training selected traditional birth attendants in the program area on clean and safe delivery and essential care of the newborn, including KMC. Every fortnight, supervisors meet all the counselors to discuss progress, strengths, and weaknesses against project standards. They share findings and try to find out solutions to challenges faced. Supervisors review the records, data, and advise as necessary. There are monthly meetings held at the sub-district offices. The field management operates under the leadership of the field manager and the 2 technical focal points through the offices located at the district and sub-district level. Monthly coordination meetings with the managers and service providers of government, district, sub-district and union-level health facilities are held on a regular basis. Access Bangladesh program has hosted a number of visitors such as Caps to Capital and Survive to 5 campaigns, U.S. Ambassador and USAID Mission Director and program professionals from home and abroad. Former Senate Majority Leader Senator Bill Frist visited the site. Access counselors, community mobilizers, and other staff are now credible members and are respected in the community.
তো এরপরে যেটা বুঝছেন তারা যে আমরা এটা খুব বালা এবং আমরা মানে গর্ভবতী ক্লিনিক ভালো মানিয়েছিল এগুলো আমরা করি তারা খুব প্রিয় করে না
They feel they have made tremendous impact in the community's long-standing behavioral patterns and are welcome at the doorstep and at community meetings. The community is happy that they are now receiving knowledge and support from the project to remove harmful practices through a worker who belongs to their own community.
লিপি আসাতে লাভ কিটা বিশেষ লাভ এটা তো আমি পাওয়ার মতো নাই মানে এই বাচ্চার পিছনে লিপির যে অবদান তা আমার ভাষা প্রকাশ করার মতো না
Services provided by the community workers seem to have made impact in the community as the community leader expresses.
অ্যাক্সেস প্রোগ্রামের যে সমস্ত কলাকৌশলী বা কর্মী আছে তারা ডোর টু ডোর যাচ্ছে গিয়া বলতেছে যে আপনাদের বাচ্চা হচ্ছে কবে হচ্ছে কয় তারিখে হবে হইলে এইভাবে চলতে হবে এই 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 পরিচর্যা করতে হবে। তাদের এই পরামর্শটা একজন পরামর্শটা একজন ওষুধের চেয়েও বেটার আমি মনে করি।
The program is off to a very promising start, and within the stipulated period of time, it is hoping to produce a thoroughly tested, replicable and sustainable model for improving newborn health in poor rural areas of Bangladesh.